Hello, everybody. My name is Reniell Iniguez, and I'm a second-year medical student at the University of Illinois in Chicago, and it is a pleasure to share with you all the research I conducted this past summer. We will be discussing the creation and then evaluation of a bilingual cultural Hispanic Latinx workshop about diabetes. I received a research stipend from the Medical Organization for Latino Advancement and the Hispanic Center of Excellence at UIC. This project wouldn't have been possible without their support. So let's just jump right into it. There is a subset of students who are known categorically as Spanish heritage learners and second language learners. Spanish heritage learners are students who have been exposed to Spanish in their homes or communities from an early age. As a consequence of that early exposure, they can understand and/or speak the language and have a personal and cultural connection to it. Subsequently, second language learners are students who acquire Spanish in an academic setting and do not identify as Latinx. These students have an excellent foundation of unique knowledge to build upon. However, when they enter academic medicine, Spanish educational resources are scarce. This may lead to an underprepared workforce that has a desire to work in Latinx communities, but lack the skills necessary to provide competent care, leading to the perpetuation of healthcare disparities. We decided to create a resource that these Spanish heritage learners and second language learners can use to learn. We saw it fitting to center our workshop around diabetes, as it is one of the most well-documented Latinx health disparities in academic medicine. In fact, research shows that Spanish-speaking patients with diabetes have better blood sugar control when paired with a Spanish-speaking physician. Our workshop consisted of a 1-hour slide presentation with interactive questions to engage our participants. We conducted 2 workshops in July and August, with 1 facilitator per workshop. Between both sessions, we had 60 participants who were recruited from the Hispanic Center of Excellence and MOLA. We implemented an IRB-approved, voluntary, pre and post workshop survey that employed a 4-point Likert scale to assess the students' confidence with various diabetes topics. These are some of the illustrations from our workshop. We created them using the Adobe Illustrator program. We were very intentional in the use of our illustrations and made them all in Spanish. This information was captured in the pre-survey. Out of 60 participants, we had 51 of them who filled out the pre-survey. Our participants largely identified as Latinx. This 92% represents the Spanish heritage learner, while the other 8% are second language learners. Participants were also asked to self-rate their Spanish proficiency and report their current academic level. We had a wide range of Spanish speakers, with 39% reporting excellent proficiency, some very good, good, fair, and poor. Additionally, although the audience had some health professionals, majority of the students were in university or in medical programs. Of the 60 participants across 2 workshops conducted, 45 of them completed both pre and post workshop surveys. So the results you all are seeing here have an N of 45. We used a 4-point Likert scale with 1 equaling strongly agree, 2 equaling agree, 3 disagree, and 4 strongly disagree. We found that participants tended towards a 1 after the workshop. That is to say that they tended to strongly agree with our confidence-related questions. For example, learners felt more confident explaining diabetes to a Spanish-speaking person with a pre-survey mean of 2.38 and a post-survey mean of 1.47. This upward trend can be seen throughout the entire table. More importantly, these differences were statistically significant. Finally, the workshop was very well received by our participants. The workshop was effective across learners with variable Spanish proficiencies, which was also significantly important. From our workshop, we concluded that more bilingual educational modalities are needed to invest in the unique skills of Spanish heritage and second language learners. We also found that a bilingual pedagogy was effective at teaching a mixed cohort of students with varying Spanish proficiencies. And finally, we look forward to seeing this innovative strategy implemented at other institutions or programs. Thank you so much for your time.